We have Dr. Vietz. She is graduate faculty at NKU for the graduate nursing program. So she's going to answer our questions and talk a little bit about the program. Is there anything you wanted to say to introduce yourself?
Thank you very much, Avery. It's nice to be here. Just on a personal note, a little bit about me. I'm currently living in Ohio, but I hail from North Dakota, where I was born and raised, and then I moved around the country for other experiences in nursing and just to experience other cultures and diversity, and then ended back up in North Dakota for quite a few years, and then moved here to Ohio about 7 years ago. And although I work at Northern Kentucky University, and the program's online, so I can live in Ohio and teach online and then zip on down to Kentucky when I need to, because we're only about 45 minutes. And by North Dakota standards, that's not much of a drive. So yeah, I grew up on a farm and but enjoyed the city as a young person. And now we live out in the country a little bit still. And I have a wonderful husband and a son who's 16 and enjoys go-karts and dirt bikes and all the fun stuff, but things that make me a little nervous since I have a background in intensive care and think about neuro and all that fun stuff. But I try not to focus on that, just enjoy the time with them.
Awesome. So our first question is, what does nursing entail? And you can talk about undergrad or graduate program nursing.
As far as undergraduate coming in to nursing, there's so many options as far as coming on in. And of course, I'm a big advocate for doing a four-year degree right away. I think it offers more opportunities. But nursing has a variety. I mean, it's right from the bedside, taking care of the patients, the families. It really involves a lot of professionalism and ethics and integrity and really having advanced knowledge, critical thinking, ability to collaborate well with others and to listen to ideas and consider what others have to say. Really listen to what the patients say and the family, because you get their story and you can take better care of them and offer suggestions. And it's a great team, collaborative profession. And it's nursing. I love nursing. Nursing is a profession of its own, and it's unique. And so you do all the things from, giving the patient a bath, to knowing all the medications and how to adjust it so you can basically keep your patient alive. And there's so many different venues of nursing. You can work in a hospital, in a clinic, you can be in the community, you can be in a school. There's just so many opportunities with nursing. Now so coming in undergrad, and then if you were wanting to move on, into some of our focus, we'll get into graduate nursing here as we talk today. NKU has, a wonderful program, and should you be an individual and you want to do maybe a 2-year degree before you get that 4-year, perhaps you want to say, you know what, I want to work as a nurse while I go to school, so maybe I'll just get that 2-year degree first, and then I want to get a 4-year. So NKU has a RN to BSN program. And then you might say, well, you know what, I think I want a master's too. Maybe I want to look at being an advanced practice nurse, like a nurse practitioner or a clinical nurse specialist or something. Then you can hop right into going right from have your bachelor's, and you can start a master's right away. And then NKU has the opportunity of, if someone wants the master's, and with that master's comes the nurse practitioner component. So one could do a master's and stop with the master's, like a master's of education, a master's of nursing leadership, or they could take the nurse practitioner part with that and get into mental health, be a mental health nurse practitioner, adult gerontology nurse practitioner, a family nurse practitioner, and then they might say, okay, so I'm good. That's what I want right there. But then others might say, well, I think I might want that DNP too, that doctor of nursing practice. So again, right at NKU, you can go right from the master's. So we have what's called a post master's DNP. So you would already be a nurse practitioner and you would just finish out the doctorate part for leadership pieces. So that's a little bit of nursing from the very beginnings to the growth.
All right. And then why did you decide to become a nurse?
That's an excellent question. I was one of those individuals early on in life. I had several different things I wanted to be. I either wanted to be a veterinarian, a doctor, a nurse, and a teacher. And I really loved teaching, but I really liked caring and figuring out problems and fixing them and working with stuff. So I ruled out the vet because I'm like, well, the animals can't talk to me verbally. So maybe I'll, look at one of the other professions. So I shadowed physicians and I shadowed nurses, and I really liked the profession of nursing a little bit more because it connected me with the patients, with people. And doctors do as well. And the doctors have their focus honing in a lot on the problems and what's going on. And I think nursing is just a little more holistic. We do similar, but we also bring in that communication piece and that collaboration, and really we're there with the patients like basically 24/7. I mean, different nurses, different shifts sometimes, but we really get to know them from the most inner part. And that's a great asset to the healthcare team, I think. So I really liked that. And I really was interested in intensive care and oncology, kind of those things that get your adrenaline going. But I love to learn, and it was just an exciting profession for me. And I really do care about people a lot and like to help people and get to know people. I just like to know about folks and what's different in their lives. And it's a wonderful, wonderful experience.
All right. And it looks like we have a question here. It says, what is your favorite part of your job?
The favorite part of my job, and also that was from Elizabeth. Thank you, Elizabeth. So when I'm taking care, when I'm in most of my work has been hospital-based and home health and prison. I've been in a few other places, but out of all of that, the patients and the families are probably the most special part, is trying to help them and to get to know them. And when I'm teaching, I think that transfers over. My most special part there is the students, because I really want to get to know the students and to help them be successful. So it's engaging, I think, with the patient's family and when I'm teaching online with the students. Of course, I do like, Elizabeth, the other parts of nursing that were very exciting, especially in my beginning years, was that rush of working in oncology and intensive care, and we got to get this done, and you really want the patient to do well, and you're calling doctors and you're working together to get orders, and you really working hard to save your patient.
All right. And can you talk a little bit about what your educational experience was like?
Yes, I would, Avery. That's wonderful. I was the person that wanted to go right away and get the 4-year degree. When I went to school, which was many years back in the mid 80s, I guess, I just decided I wanted a 4-year degree right away for me. And so I went right out of high school to become a nurse and did that. And then I worked about, 3 or 4 years, and I started getting antsy and wanted to do some more education. I think about 3 or 3.5. And I went out to Loma Linda University in California and did a master's as a advanced practice nurse. And back at that time, they didn't have as many nurse practitioners. So I went with a clinical nurse specialist route. So I'm an advanced practice nurse, but a clinical nurse specialist, and which was a perfect fit for me because I like all the different roles. With clinical nurse specialists, you do patient care, research, and just do a whole venue of opportunities. You do leadership roles, teaching, so it was perfect. So that's what I did an advanced practice nursing degree. And then I worked in that for a long time, and as a nurse manager and a clinical nurse specialist. And then, and I did a lot of that work out at Loma Linda, and then also at Johns Hopkins Hospital out in Maryland, and then back in North Dakota in different places. Then I decided while I was in North Dakota and I was teaching also full time, I kind of transitioned from a advanced practice nurse, also moving into full-time faculty roles, both in the clinical and the classroom. And I decided I needed to get my PhD. So I completed the PhD in nursing and focused my research on student learning, which of course, because I love the students and I like to help them learn. And I know there's different learning styles, and I just think it's really important to try to reach the students where they are and to help them the best we can. So that's where I'm at. And now I continue on with continuing my education to keep up current with my profession.
All right. And it looks like Olivia asked, what's the difference between a 2-year or a 4-year nursing degree?
Thank you, Olivia. That's an excellent question. The 2-year degree, and I'll try to clarify a little bit too. A 2-year degree in the traditional sense gives you like an associate degree. So you cover very similar elements as a 4-year degree in the sense of undergraduate nursing, but there's more intensity focus with the clinical care component. And then the 4-year degree, or the BSN, sometimes you can do either of these, 2-year or 4 years, as we call it, more quickly. It doesn't necessarily take you a whole 2 years to do an associate, nor does it necessarily take you a whole 4 years to do the BSN. So maybe I should reframe that and say an associate and a bachelor's, or a Bachelor of Science in Nursing. So the bachelor's encompasses more, it's broader. So it also covers all the clinical components, but you also get a much richer sense of research, theory, community health, mental health. It offers more opportunities for leadership and education in nursing opportunities of employment. Does that make sense, Olivia? I'm sorry, I didn't mean to confuse you. So the associates is typically used to be a 2-year program, and the 4-year is the bachelor's. However, as we've advanced in our careers and education over the years, an associate could be done, possibly in a year and a half, and the same, the bachelor's could be done, maybe 2.5 or 3. So there's accelerated programs, I guess, is what I want to say for that too. Anthony said, is RN the associate level? RN, registered nurse, is the title for whether you have an associate or a BSN. So registered nurse is saying that you have taken the national licensing exam to be a registered nurse, and you would do, there's a national registered nursing exam for an associate level and one for a Bachelor of Science in Nursing level. But either way, whether you go with an associate level or a bachelor's in nursing, you still take the licensing exam and you're still a registered nurse. It's just a matter of job opportunities, whether you want the 2-year degree or the 4-year degree, associate or bachelor's.
All right, great questions.
Okay.
Our next question that we wrote was, where did you work? You kind of touched on it a little bit, but if you don't mind going into more detail just about where you worked before coming to NKU and what that was like.
Okay, so when I graduated from nursing school as an undergraduate with my bachelor's in nursing, I worked in Missouri. I also worked in Kansas and Missouri in a hospital setting. I worked when I was a student, I did some med surg and some psychiatric nursing. And then my first job out as for a bachelor's prepared nurse was in oncology. And I really loved that. And then I really got connected with the patients, and it was hard, and the families. It's hard to see folks really struggling through that and not always having the best outcomes. And so I decided that before I burned out within a year and a half of starting my career, I decided I wanted to move into still a critical area, but where I might be able to see some people get better. And of course, now we've made big advances in cancer since those days in those late 80s. So things are much better than it used to be. But anyway, I made that switch into the ICU then, and worked in North Dakota in a hospital setting in a neurosurgical ICU and a cardiovascular surgery ICU and an emergency department. And then I I started my master's as I was in North Dakota, and I moved to California to work on my master's and get my advanced practice nursing degree. And there I did agency nursing and home health because it fit with my schedule and school. And I did with my agency nursing, took me to working in prisons as well as going in people's homes. And so I just had a lot of diversity, which was wonderful. And then when I finished that, I moved on out to the East Coast and worked at Johns Hopkins Hospital, again in cardiology and cardiovascular surgical care, and was an advanced practice nurse and started a program, helped convert a medical surgical unit into a cardiology unit. So taught the nurses, so I used the education component of my advanced degree in teaching nurses how to read rhythm strips, heart rhythm strips, and how to look for certain things cardiac wise. So it was really fun. And then I became the nurse manager and did that for several years. And on the side, I still taught in a classroom setting. And then it took me back to North Dakota, where I went full-time teaching in a university and also worked in the hospital 2 days a week. And I had students with me as well, and still, again, in ICU and cardiology units. And then I moved on out here to Ohio and found NKU. So those are some of a snippet of the things that I've done. Very brief, but.
Yeah. And that's a good transition into our next question, which is, why did you decide to start teaching at NKU?
Another excellent question. When I first moved to Ohio, I had looked at Northern Kentucky University and really liked what it stood for. And I also had a friend who worked there, and I thought, I think that's where I'm going to work. And but it did take a little time because there wasn't an opening right away. But what I really appreciated about it was there seemed to be such an emphasis, and I see that displayed now as I'm teaching at NKU, where the student is a focus. Really looking at student success and doing what one can do for the students. I mean, of course, when we're students, the students also do their part very graciously, try to keep up and do what needs to be done on their end. But as a faculty, I like to do what I can do on my end to help the students. So that really appealed to me. And people were very friendly and welcoming, very appreciative, and really showed caring. And I really like the service opportunities at NKU and how much service NKU does in the community and involves the students in. I mean, if you want to be involved, there's something for everybody. And I really, really liked that feature. That also was a big component of my work is service. And so really appealed to me. The student success, focus with the students, and diversity and service. Those were the big pieces that captured my interest at NKU.
All right, awesome. And our next question is, which graduate programs do you teach, and kind of like what's the difference? I know you kind of talked about the undergrad programs, but.
That's all good. So I teach in both programs, the master's and the doctoral program at NKU. And I really like the arrangement I currently have. So for the master's component, I teach the very first class when the students are coming into a master's in nursing. I teach the theory and research course. The first one, it's like their very first ever class, usually in a master's program online. And some have been out of school for a long time, and some are coming back in right away out of high school practically, or just right after they got their, of course, their BSN. So different levels of students come in, but it's the very first class, and we introduce them to the basics of nursing and theory and how it all began and where their journey may take them, and how to learn a little more about research, how to read research, how to know if it's credible, and they can apply that to their practice. It's really great, especially in nursing, as you currently are in nursing. And then if you're going to go on and be a nurse practitioner, if one knows how to look at the evidence and look at the research, it helps your profession to give the best care to your patient. So that's where I start. And then in the doctoral level, I have the students who are getting close to done. I work with them for a whole year, and we work on their project, kind of their end of year scholarly project of how they're going to implement a change in their, at wherever they're doing their practicum. And that might be where they work, but they do their work as a student, and they can't count those hours as they work, but they do extra work where they work possibly to complete their project. And so it's quite phenomenal. So those are basically where I'm at. Start at the very beginning and help them finish it all out at the end.
All right. And our next question is, what is the curriculum like in a graduate nursing program?
So at NKU, I'll speak to that a little bit more. And I guess I alluded to that a little bit. There's the master's program. Well, there's more than master's, but since we're talking graduate, we'll do the master's and the DN and the doctorate of nursing practice. So the master's in nursing degree, there's different components. So one could get a master's in, say, nursing education. One could get a master's as a, I think it's called the nurse executive leadership role. And one can get a master's in being a family nurse practitioner, a master's in doing an adult gerontology tract, a master's as a mental health nurse practitioner. So those are like the master's component. Now, as far as curriculum, there's many different courses, but some of the broad courses that everyone takes, of course, is they're going to look at nursing theory and a lot of different classes on evidence-based practice and research and health policy, statistic courses, but in the sense, not a traditional math statistics. I mean, it is, but it isn't. It also is about health. How do you apply it? So once you learn about the statistics, it's more of a healthcare statistics, which is really cool and a little more applicable to our profession. And then those are some of the broad, that's a very broad component there. There's other classes, of course. And then there's the concentration or the core classes specific to whatever. And when I say a tract, it's like that specialty. So everyone's in a master's, whoever comes into the master's program, they're in that master's program, but then they eventually branch into their specialty. So it could be they branch into family nurse practitioner. So then they're going to take core courses, clinically, more clinical focused to be a family nurse practitioner. And so they'll get into more advanced pathophysiology, advanced pharmacology, diagnostics, and all of the different kinds of things that pertain to family nurse practitioner. And then the same for the other two, gerontology, adult gerontology, and mental health. So that's kind of how it works. And then when the students complete that master's NP tract, if they want to continue and get their doctorate of nursing practice, they can do so. So most of the time people are already, some come in, so some folks come through NKU and get their master's as a nurse practitioner and then just keep going and moving into the doctor of nursing practice. Others come to us from another institution with a master's and they're already a nurse practitioner and they jump right into our DNP. So there's different venues that students can do.
All right. And then just a reminder, everybody, you can keep putting questions in the chat if any come up while we're asking our questions. And our next one you kind of talked about too, which is what sets NKU's graduate program apart from other schools. Is there anything else too that's special about NKU that you've noticed being on campus or online?
Yes, well, and on campus, because I have now, of course, COVID has hit our world. And so I've not been really on campus for probably the whole last year. But although we're online and we teach online, I would make periodic visits to the campus for meetings, or, our meetings are all Zoom too. They were before and they still are. But we could go down, at least if we wanted to, and connect socially. And I usually did that. But not, of course, recently. However, going to the campus, I love the campus. That was something else that drew me to NKU. It's beautiful, and it could be because I like the country and I love the pretty green and the hills and the streams. And so it was very appealing to me. And plus it's beautiful. The buildings are beautiful. I mean, I think the students are well taken care of. I guess, Avery, you could maybe speak more to that yourself as a student, but from what I can see, there's a lot of great features for students. The library, and there's some great food options and dorms, and it's big. You can get around easy. There's parking. And parking is parking no matter where you are. There's always sometimes challenges to find a parking spot for probably students and faculty too, but it's all good. There's at least a place to park, and that's wonderful. So yeah, it's a beautiful campus. So for a face-to-face and a physically on campus setting, I think NKU is top notch. And and Carolyn, thank you. She put a link in to see the Health Innovation Center, which is where our nursing programs are housed. So that's one thing. There's so many options as far as, and I think I already mentioned how I think faculty and staff, administration really care about the students. That's very important. Just from my work at other universities and friends who have young people at other universities, I think NKU is quite cost effective compared to tuition as compared to other places. I think it's very college tuition is always an expense, and that's all on people's minds, and college can be expensive, but I think NKU is quite cost effective overall in comparison to some other universities. So quality care for a lower price. I mean, you go. But I think that's the biggest part. There's also to NKU, which I really liked. There are academic advisors that are assigned for students. So academic advisors. So for nursing, we're housed in the College of Human Services, College of Health and Human Services. And within that college, which is a college of NKU, is the School of Nursing. And but the college itself has academic advisors, and those advisors are split up amongst the different health programs in our college. And so we have several different really wonderful academic advisors to help students with the registration, with questions. If students get going in something and they run into some struggles, our advisors are very helpful, and I have really seen them quite active, and I think that's a great plus at NKU. Also appealing to young people coming in to the nursing profession, others as well, but nursing in the graduate program has 7-week courses, so they're quite accelerated. So it's kind of like semester work in 7 weeks. And so that's why I think the program moves so quickly. You can get through a program quickly, but you are really working hard because you only have 7 weeks to complete all the work in one course. And then you get that done, and then you move to the next 7 weeks. And we always encourage students to take maybe just one course in those 7 weeks, but sometimes they would like to take 2. But really no more than that, because it's almost like a part-time job just for one course, because you have to put in probably about 20 hours a week. So you're working hard, but it's a attractive option for some students. So I think that I would count as a plus in that sense. And faculty, the other piece that I really like, nursing faculty work well together, really care about the students and really try to help them out to what we can within reason. Of course, there's regulations, and we want students to have a very robust and well-grounded academia provided. So it's not like, we're like, oh, just do whatever you want, but we're like, these are the boundaries, these are the structure, this is the guidelines, these are the grading rubrics, but we'll do what we can to help you and make it clear so you can understand it and so you can do what you need to do. So I think students get a very well-rounded, well-grounded education at NKU, along with hopefully having a pleasant experience. So. Oh, we also have a great IT team. That's something else that was very important to me as an online professor, because no matter how much you do know a little of IT, to have a actual department and people helping you out, and we have folks, and this is for the students as well. Information technology, we have an information technology department that helps with all these technology issues. Plus, we have a department that helps us with our online learning platform, which is Canvas, where you submit assignments and so forth. So we have great support, students do and faculty do, and I consider that a plus as well. So just another little something.
I definitely do too. And then how will somebody get into the graduate nursing program at NKU?
Okay, and now I know Carolyn posted earlier on, there's a website, or so if you go even to, nku.edu, if you don't get this link, she has, but Carolyn already has it set up where you go to online degrees, nku.edu. But if for some reason you don't have that, or you forget, at least if you get nku.edu, you can go right in there and, pick your online graduate degree for nursing, and you can look at the curriculum for the MSN, for the DNP. That is awesome. And then when you get onto that main website too, there'll be an option to select where you want more information. You can just click on it and say, I'd like more information, and someone will visit with you or send you some things. And if you think you want to go ahead and apply there, or you just want to look and see what you have to do to apply and what would be the requirements, you can click on application and it will show you like some of the requirements. So as far as a GPA, typically for the MSN and DNP, at least a 3.00 GPA. And then since one would already be a registered nurse, you would need to show a copy of your nursing license verification. And again, I'm talking about graduate level here. And then you also would need to have a letter from your employer saying that you've worked 1,000 hours already in a clinical setting. So whether that's in a hospital or a clinic or a school nursing or something, you would need 1,000 hours of working as a registered nurse. So those are the bare minimum pieces. If you are looking to go into like adult gerontology or acute care, adult gerontology, acute care nurse practitioner, for that you would also need to have worked in an intensive care unit and need verification of that. So you'd have to have worked critical care. So some of those hours would come from there. So I guess the bottom line, as far as getting into the graduate nursing program, there's an application process that you would have to go through. That would probably be the place to start. So you could get onto the website, check it out, see what looks good to you. You can see the whole curriculum, what exact classes are for each specialty track. And then you can see what's required to apply and see if you meet all that criteria, and then you can move on forward. And then once you submit everything that's required for the application process, we typically have an academic advisor would reach out to you, or someone from the program. So there's usually always communication by email for sure. And then also you're always welcome to call to talk with an academic advisor. And on those websites, on the nku.edu website, there's also the academic advising department's numbers for the various advisors.
All right. And then Olivia asked a question. Did you already read it? I saw you were looking at the screen.
Yes, I was just
Okay.
looking at that. Sorry, thank you, Avery. I'm sorry, it pops up and triggers me. I don't want to take your job away, though. So Olivia was asking, do all master nursing programs require 1,000 hours of clinical experience as a registered nurse? At NKU, yes. And in the other institutions that I've taught at, they also required a certain number of clinical experience as a registered nurse. Some would say 2 years. You know, it's gotten different through the years. When I first started out, sometimes, especially because when I went into my advanced practice nurse, I wanted to be and that's what I got my master's in, was a critical care clinical nurse specialist. So I had to do very specific and a great number of hours in intensive care, critical care setting before I could apply to that. So I had practically 3 years already in. So some programs may require more hours. Maybe other programs, maybe 500, I'm not sure, but for the most part, 1,000 hours at least is required of working, and which could be, you know, less than a year's work, I guess, in some cases, because if you're looking at clinical hours working, usually 2,080 roughly are considered for a full year. Does that help, Olivia? So at NKU, 1,000 hours of clinical experience are required. Yes. Thank you. That was a very good question.
All right, and then we have our last question. So if anybody else wants to put some more in the chat, we can get those answered. Our last question is, what is the most rewarding part of your job?
The most rewarding part of my job, and again, it's kind of what took me into nursing, it has remained constant, is the people. Whether it's my colleagues, which of course I always enjoy. It's nice to have that teamwork and collaboration. But at the heart of the matter, when I'm in taking care of a patient and family, that's the rewarding part. And particularly if they're getting better, or they just thank you for something you did. Boy, that just is all you need for the day. And the same goes for the students. When I'm teaching online, as I'm doing currently, it's the students that are working so hard and trying so hard to do their best, and then it's always a plus to hear those nice words that they learned something in the class and they enjoyed it, or just that's what it's all about for me as a people.
All right. And then if anybody wants to have their last minute questions answered, they can go ahead and put them in the chat. Is there anything else that you wanted to add or mention?
Well, I would just put a plug in if you're looking, and healthcare is for you, and particularly nursing. I think there are many good programs throughout the world, and since we're living here in the United States, I'll say United States for sure, and because I've been different places, there are many good programs. You really need to find the one that is a good fit for you. But I'll tell you what, NKU is top notch. I've been very happy as a faculty person here, the students. I just think they take really good care of the students and us as faculty too. So of course, I would encourage you to come to NKU. We love to have you. But most importantly, evaluate and research and take a look at those programs and see what works for you in your life at this time. But I think that's something else NKU is really good at, is they really do try to work with students regardless of the circumstances. And the other big piece of NKU, to bring it all around, something in a previous question I forgot to mention, was the fact that the focus, any student can come to NKU, but there's a particular emphasis in helping those students who may not have opportunity or have limited opportunity in other universities that are terribly expensive. And NKU really reaches out, and they have some great programs of helping students. There's a field program, so they can help students sometimes if they need help with textbooks or if they need food. I mean, really meeting students where they are. I mean, sometimes that means taking care of basic needs. So that is another part to NKU that I hadn't seen as much other places, other than when I worked at Johns Hopkins Hospital in the hospital arena. That was another place that had a lot of resources to help patients, because we took care of a lot of homeless as well. And that was a mission of Johns Hopkins Hospital, is to help those who are struggling. So okay, and from Olivia, what universities did you go to get your bachelor degree, master's degree, and doctorate degree? Thank you, Olivia, for another good question. I went to a private college, a religious based private college called Union College in Lincoln, Nebraska, and did my bachelor's in science nursing, which during those years was actually a 4-year degree. And so I went there, and then I went on out to Southern California, actually in the city of Loma Linda, and went to Loma Linda University to do my advanced practice degree, master's. And then I went on down to Utah and went to Rocky Mountain University of Health Professions and did my PhD.
All right. Looks like that might be all the questions. I know Carolyn put in some links just kind of for more information about the nursing program and the health center. And then, one more question.
Let's see, how many clinicals are in the master's degree? Olivia, that is an excellent question, and I would have to look to tell you specifically, but there's usually, I would have to look that up, Olivia, for sure, but I know there's a clinical with every core course. So if you were doing like physical assessment, that is done more with simulation, I think, and some pieces. So there's physical assessment, and then you would get into your core. So I would say about every 7 weeks, when you get into the clinical courses, you would have a clinical. And I'm sorry, I just don't recall the number off the top of my head, Olivia. That's my best answer right now, but I could look that up and get back to you, or if Carolyn has a way to reach you, I could let you know that information. You're welcome, Olivia.
We can always email some stuff out afterwards to everyone who attended today.
All right, that sounds great. How long did the master's degree usually take? Another great question. If one is doing a master's in one of the, I did jot this down here for that one. If one is doing the master's in education, that is typically 12 months. And if one is doing the master's in education is 12, and there was another one there a little shorter. The master's in leadership, I think, is around that as well. If one is doing the master's for the master's and getting their NP, those usually run about 20 months. Maybe in one of our programs is 22. So 20 to 22 months roughly is the time frame for the master's with any NP. So that would be like family NP, adult gerontology. If one's doing I think it might be the adult acute gerontology nurse practitioner, that might be the 22 months. For the family nurse practitioner, that one is 20 months, I do believe. And again, these are, this is how the programs are advertised and based on approximately, pretty much that's close to it, but we also realize things happen in students' lives. So while this might be the framework, sometimes it may take longer if one needs to cut back how many courses they can take, or if they end up having to work too much and can't take as many courses, it could alter that time frame.
All right, lots of good questions.
Well, thank you all very, very much. And Anthony, you're welcome, and Olivia and Mary, Elizabeth, Olivia, and Anthony and Mary. And Nancy, it was nice to visit with you as well. Thank you. And Catherine, it's nice to, I've enjoyed seeing people's names and hearing those questions. That's been wonderful. And maybe one day I'll get to see your face. So thank you very much.